they may indulge in some risky behaviors too, where they can get this infection, and due to the stress effects, they can maybe die because of HIV, and others choose not to take their medications.
It is now clear that moral decay among the minors has caused a spike in HIV infections. Samuel Namkana, Switch TV, Nairobi.
Thank you, Samuel Namukana, for that story. Moving on, celebrations to mark the World AIDS Day were held in different parts of the country, with the national one being in Kajiado County. A spot check of several counties, however, reveals that there is more on policies that are needed to cater for those living with HIV and AIDS. David Kagina now reports.
Mother-to-child infection has drastically reduced in Murang'a County. According to Winnie Kanyi, the County Director of Health, who was speaking during the county celebration, the prevalence here has gone down.
Last year we were at 20.4%, but now we are at 9%. So we are happy with that improvement, and we intend to continue working hard.
However, the number of young people being infected with the virus has been rising steadily, and according to the county's women representative Sabina Chege, the government has a role to play.
Na pia tumeona vijana wengi ambao hawajafikisha hata miaka 18 ama wadogo, wale youth below 35 ndio wengi wameathiriwa na hizi virusi. Na tungetaka kuhakikisha kwamba hata wale watoto, hiyo ni ule umri watu wanaanza kupata familia, watoto watapata wasipate zile virusi.
For approximately 1.5 million Kenyans living with the virus, things have changed, and a good number of them have learned to live with the virus, some leading by example.
Na life yangu tangu nipate HIV nikaya watu wengine. Sometimes ukiniangalia huwezi jua that I'm positive.
Kama mimi nimeishi na virusi vya ukimwi miaka 30, na ni jukumu yangu kuona ya kwamba ninaongea na wale watu wako na virusi vya ukimwi ili niwapatie motisha ya kuishi na virusi, na pia waone kwamba ukiwa na virusi vya ukimwi sio mwisho wa dunia.
There is also a call for a bill to be presented before Parliament to pass a law that will allow the formation of an authority that will fight and represent those living with the virus. David Kagina, Switch TV.
Thank you, David Kagina. This year's event was held in Kajiado, where the local county government unveiled an ambitious plan to end mother-to-child transmission of HIV and syphilis by the year 2024. The plan, supported by First Lady Margaret Kenyatta's Beyond Zero campaign, will enable Kajiado County to mobilize resources and implement programs aimed at ending the two diseases. Kajiado County has a HIV prevalence of 3.4%, with more women infected at 4.5% compared to males at 2.3%, carrying a disease burden of slightly over 30,000 people living with the virus. Robert Homer reports.
Mother-to-child infection has drastically reduced in Murang'a County. According to Winnie Kanyi, the County Director of Health, who was speaking during the county celebration, the prevalence here has gone down.
Last year we were at 20.4%, but now we are at 9%. So we are happy with that improvement, and we intend to continue working hard.
However, the number of young people being infected with the virus has been rising steadily, and according to the county's women representative Sabina Chege, the government has a role to play.
Na pia tumeona vijana wengi ambao hawajafikisha hata miaka 18.
Many apologies, that story will be coming up shortly. Each year on 1st December, the world commemorates World AIDS Day. People around the world unite to show support for people living with HIV and to remember those who have died from AIDS-related illnesses. Each World AIDS Day focuses on a specific theme. This year's will be Global Solidarity and Shared Responsibility. This year's theme joins a growing list of challenges that World AIDS Day has altered people globally.
Founded in 1988, World AIDS Day was the first ever international day for global health. Every year, United Nations agencies, governments and civil societies join hands to campaign around specific themes relating to HIV, including awareness-raising activities around the globe. Many people wear a red ribbon, the universal symbol of awareness of, support for and solidarity with people living with the virus. These international events highlight the current state of HIV as it continues to be a major global public health problem, having claimed almost 33 million lives to date. However, with increasing access to effective HIV prevention, diagnosis, treatment and care, HIV infection has become a manageable chronic health condition, enabling people living with it to live longer and healthier lives. COVID-19 pandemic has caused a lot of uncertainty across the globe, including for people living with HIV and AIDS and other viruses. And managing more than a single virus has become a great challenge for many, especially those living in informal settlements like this one. Though there is no direct connection with the two viruses, people living with HIV and AIDS have been categorized as those with underlying conditions when it comes to COVID-19 pandemic. Hence, they must be on a good diet.
Good nutrition is very important because, one, it improves the quality of life by also slowing down the progression of the HIV virus itself. So good nutrition, it increases the chances of person living, and also it reduces the death rate. So good nutrition plays the major key role in fighting the HIV virus and also in fighting the COVID-19.
COVID-19 pandemic has, however, brought about uncountable tribulations, including the country's dwindling economy. Beth Akenye has been living with HIV for the last 5 years.
Hiyo maisha ni ngumu, saa zingine unapata tu kidogo ya kukula. Kiko vitu kutoka yangu. Niseme pesa hakuna, unapata kidogo, una manage, unagawa kidogo ya kulipa nyumba, kidogo unagawa ya kukula.
There were an estimated 38 million people living with HIV at the end of 2019. Of this population, not everybody is able to access HIV testing, treatment and care. Notably, the 2018 Super Fast Track targets for reducing new pediatric HIV infections to 40,000 was not achieved. Global targets for 2020 are at risk of being missed unless rapid action is taken. This is according to the World Health Organization, WHO.
The under 5s, the pregnant, also the HIV, you talk to a client, they come. The reason why they've got rapid weight loss, they tell you, due to work, I was stopped at work. And this is the person who is the breadwinner of the family. We should also focus on food security, which plays a major role. But in our setup of the community, there are some families, it's hard for them to survive.
Due to gaps in HIV services, 690,000 people died from HIV-related causes in 2019, and 1.7 million people were newly infected. Key population groups and their sexual partners accounted for over 60% of all new HIV infections globally. Among the age group of 15 to 49 years, an estimated 62% in 2019. Over 2/3 of all people living with HIV live in the WHO Africa region, estimated to be 25.7 million people. While HIV is prevalent among the general population in this region, an increasing number of new infections occur among key population groups. WHO defines key populations as those who are at increased HIV risk, like men who have sex with men, people who inject drugs, prisoners, sex workers and their clients, and transgender people. In Eastern Europe and Central Asia, Asia and the Pacific, Western and Central Europe, North America, Middle East and North Africa, these groups accounted for over 95% of new HIV infections in each of the regions. 30-year-old Maureen Ochieng, a peer educator in Kibra, has been living with the virus for a decade now.
Kwa na mimba nikaenda kliniki kama kawaida. Ukienda kliniki mama mjamzito lazima upimwe, na si optional, la kwanga lazima. So nilipimwa nikapatikana ni HIV positive. Though haikuwa rahisi, haikuwa safari rahisi. Ilikuwa ngumu, nilikuwa on denial for long, but ilifika mahali nikasema hapana, naweza kufa na sitaki kukufa. Ilibidi nijikubali, nianze kutumia madawa.
Dental tu, yani hizi jua, hata mimi nilinia kwanza nilijua niko na TB. Sasa hapo ndio nikajua sasa kumbe niko nini.
COVID-19 pandemic has not only affected HIV patients financially but also socially and psychologically.
sisi ndo tuna sensitize kuhusu hiyo COVID, what to do. Inafaa sisi ndo tuambie watu unafaa kufanya nini ili ujiepuke na hii ugonjwa. So haikutu affect vile sababu tuko kazi, ni vile tu mentally imeni affect kiasi cause nikisikia wakitangaza hata kwa TV ati ukiwa na underlying condition ati ikikupata inaweza kupeleka chini haraka. So mentally nimekuwa worried.
Stigma is one of the major challenges those living with the virus still experience in this day and age.
Nilikuwa naishi na watu hapa, nimeishi na madada wangu. Nimekaa nao for long. Na sasa venye walikuwa naanza kunipea madharau nini hivi, ukimwongelesha na kujibu venye nataka, niliamua kubaki peke yangu na mtoto.
Know yourself, who you are, what do you want, who needs you. Huyu mwenye anakustigmatize ana play role gani kwa life yako?
Just like anyone else, they too have the right to love, be loved and respected in all spheres of life.
Sisi wenye tunaishi na virusi tunafaa kujiprotect during sexual intercourse, na hizo vitu tunatumia zile tu mtoto sasa. Hizo vitu tunatumia, wengine wana complain haziko standard vizuri, zingine zina burst on the process. Sasa inawaeka at risk, maybe your partner is HIV negative, anapata hiyo risk. Sasa inabidi ameze PEP na hakuwa ready for PEP.
Sijui ni kwa nini wametoa. Na hiyo pia unajua inasaidia kwa mwili sana. Sijui kwa nini sahihi ipatikane.
Septrin is used for immune-depressed patients to prevent opportunistic infections. HIV can be diagnosed through rapid diagnostic tests that have greatly facilitated diagnosis and linkage with treatment and care. HIV self-tests are increasingly available and provide an effective and acceptable alternative way to increase access to people who are not reached for HIV testing through facility-based services. To date, there is no cure for HIV infection. However, effective antiretroviral drugs, ARVs, can control the virus and help prevent onward transmission to other people. And according to WHO, at the end of 2019, 25.4 million people were accessing ARV therapy. Between 2000 and 2019, new HIV infections fell by 39%, and HIV-related deaths fell by 51%, with 15.3 million lives saved due to ARV treatment. Safi Godanamamo, Switch TV.
With Safi Godana's story, now take a short commercial break. Stay tuned, we'll be back with more. Welcome back and thank you for keeping it Switch TV. We are live on YouTube as Switch TV Kenya. Send in your feedback to our SMS line 111 444 111 and at Switch TV Kenya and at link on all my social media handles. Kenya has today recorded a total of 551 new COVID-19 cases of the past 24 hours. As our reporter Majibu Kitsao reports, efforts to come up with a COVID vaccine are also underway as the Kenya Medical Research Institute KEMRI will collaborate with researchers from other countries in coming up with an effective drug.
Kenya has today recorded a total of 551 new COVID-19 cases in the past 24 hours. 5 deaths have also been reported, bringing the total number of deaths to 1,414. However, 266 patients have recovered, bringing the total number of recoveries to 18,146.
Today, 551 people have tested positive for the virus, following testing of a sample size of 4,675 over the past 24 hours. This brings to 84,169 the number of confirmed positive cases in the country.
KEMRI is set to collaborate with other countries including South Korea, India, Singapore and China, among others, in a bid to come up with an effective COVID-19 vaccine.
KEMRI will continue to collaborate with researchers from other countries such as South Korea, India, Singapore and China, among others.
As Kenya joins the world in celebrating the World AIDS Day, Health CIS Dr. Rashid Aman has noted that the pandemic has also posed a challenge in the fight against HIV and AIDS.
The COVID-19 pandemic poses a challenge to the uptake of HIV testing services due to low outpatient hospital visits during this period.
Dr. Aman has also urged Kenyans to continue observing the COVID-19 protocols so as to contain its spread. Reporting for Switch TV News, my name is Majibu Kitsao.
Thank you, Majibu Kitsao. A spot check by the Senate Health Committee at KEMSA Hardware in Embakasi has established that PPEs worth 3 billion shillings cannot be sold due to lack of authorization from the Health Committee. The committee says that a case by the EACC has stalled the distribution of the PPEs. They now want the EACC to speed up the case. The major concern is that as the PPEs continue to collect dust at the warehouse, the market price is dwindling and the time limit of 2 years given is running out. So far, the KEMSA management say that they have only sold PPEs worth 2 billion shillings.
And the minister, we agreed that we were supposed to come and check on what's going on and how they are distributing, they have distributed the PPEs and the masks and all those things for the COVID. We've just been informed today from the 7.6 billion of items procured. They have at least distributed or sold around 1.9. They have they are about to supply and give to the counties items worth around 3.9.
Tumeona vitu ambazo waliweza kununua ziligharamia karibu bilioni 7.6. Wameweza kuuza kama za karibia bilioni 2. Kuna kama zingine za bilioni 3 ambazo hawawezi zishika kwa sababu EACC iliandika barua ikasema kwamba hizo vitu kwanza zikae kando, zinafanyiwa uchunguzi.
Let me just start by saying this. I think it is very important that the EACC expedite their investigation. I've just made a quick glance and I've walked through the warehouse. There are millions and millions of PPEs and our people are dying of COVID. Our men and women in the healthcare are being exposed to the virus, yet we have a lot of supplies here. I think the judiciary now and EACC should set aside 30 days. If you can be able to set aside 14 days to determine a presidential election, why can you set aside 30 days to be able to determine what can be done to those things?
Meanwhile, as the country continues the fight against the spread of COVID-19, the Kenya Red Cross Society, in partnership with the Mastercard Foundation, is conducting fumigation of markets across the country. The fumigation is in partnership with county governments targeting the counties of Kajiado, Eldoret, Mombasa, Nairobi and Nakuru. The fumigation is also done with DJI Agres drones, making the work easier by covering large areas within a short time. The activity is done during the night when the marketplaces are devoid of people. Moving on, collection of signatures has been ongoing in many parts of the country, with today being the last day of the 7 days ultimatum given to the steering committee. Siaya Senator James Orengo has, however, told off politicians who claimed that the BBI process is not inclusive, as well as those saying that the process being followed is not that of the Popular Initiative.
It is called Popular Initiative because the process does not go through a parliamentary process. There is a distinction between a parliamentary process and a popular process which does not have to go through the parliamentary process. And after the signatures, it will be taken to county assemblies, it will be passed, it will go to parliament. Whether parliament passes it or not, will go for referendum. Therefore, those who are carrying out rumors and misleading the public that this is not popular initiative, it is popular because of the kind of process it is going through. And that should be made very clear. Secondly, it is popular because signatures have been collected and are being collected all over the country. It is not going through parliament. It's going through the people. And if you look at the bill, the title of the bill says that it is enacted by the people of Kenya because it's a popular process. So I wanted to make that very clear so that the people who are trying to mislead people, they cease to mislead the people. They should just direct their attention to the content of the bill.
And away from politics, it's time to delve into the world of commerce with Clifford Ndubi.
Thank you, Lincoln Wambugu. Good evening and welcome. This is the latest from the world of business. My name is Clifford Ndubi. The National Treasury has assured Kenyans that the government will not default paying her loans in time. The Cabinet Secretary of Finance and Treasury, Ukur Yatani, has said that plans are underway to cut down expenditure in the counties and the national government. John Kutuni has filed this story.
The National Treasury is promising to cautiously cut down expenditure in county and national government without hurting Kenyans. Speaking during the budget public hearing session, Yatani has assured Kenyans that the government will pay all the loans in good time.
Completely knock down foreign travel, and we just leave like 25% for domestic travel. The attendant benefit, we also don't have to look at just cutting costs is one side, but the impact of that negative cut, it can also have consequence of the domestic economy and tourism and hotels.
With nearly 66% of Kenya's external debt denominated in US dollars, the government is looking to increase uptake of euro-denominated loans, a move that will mitigate against currency fluctuations.
Even at the private levels, when we talk of like Eurobond and the rest, the stocks that we are currently holding for Eurobond and the rest, normally, when they mature, it's been our desire to roll them out. Pay, but also have the same, so that we are not seriously constrained in terms of pressure to settle the same. I am very optimistic that our debt indicators will improve as the economy opens, and it is actually opening.
There are frameworks to restructure loan terms to allow the country to have extension to loan maturity that will give the government room to acquire more loans with favorable terms. The government also is moving away from the treasury bills that will take a shorter time to mature compared to treasury bonds. Reporting for Switch TV, my name is Joan Kutun.
Thank you, John Kutuni. The world's most traveled man, Fred Finn, has endorsed Kenya to be ready for tourism businesses amidst the challenges posed by the COVID-19 pandemic. Finn said that although there was restricted movement globally due to the ongoing COVID-19 pandemic, he was glad to have traveled to Kenya and commended the protocols undertaken to prevent visitors from contracting the virus. Since his first flight in 1958, Fred has flown 24 million kilometers and has visited more than 150 countries. In 1983, he was certified by the Guinness Book of World Records for having flown more air miles than any other passenger in history. Since then, no one has come close to matching his incredible feat, and he has more than doubled his tally over the last 37 years. Take a look. Right, with that story from Fred Finn, we now switch to the world of sports. Lincoln Wambugu, take it away.
Thank you, Clifford Ndubi from the Sports Desk. Kenya Premier League side Mathare United has today unveiled a one-year sponsorship deal with their new partners 555bet as sponsors for the 2020-2021 Kenya Premier League season. The firm has contributed 20 million shillings in cash and much more in form of training gear and equipment.
2008 Kenya Premier League champions Mathare United has secured 555bet as their new sponsors for this Premier League season. The betting firm has pumped in 20 million shillings on the KPL side for the next 1 year, with the option of extension for further years. A move expected to improve the team's performance in the coming seasons.
It's a stability for my players, and the most important thing is they'll remain focused, because at the end of the day, money is the key thing in our lives. They've been struggling for some few years, especially this pandemic. And of course, when 555 came in, it's a sign of relief to our team. And of course, it's hopefully to a better performance for this season. And we try and see the next season the outcome.
After the halt of all sporting activities in the country due to COVID-19 pandemic, the team reverted to training their players individually and in groups. However, after the resumption of the league last weekend, tactician Salim Ali has alluded that they have quite a hard task ahead.
In a normal pre-season program is 8 weeks. And as per what we've done, we've trained for lesser time. And of course, we are not training for training, we train with purpose. And of course, after the government gave an issue last week to go ahead with the league, and of course, league kicked off over the weekend, it's a sign of relief to our side, and hopefully we'll try and work as a team. We'll try and put a tight program where we can manage and try to minimize the weeks that are coming.
The Slum Boys have been without a sponsor for the current campaign, leading to a high turnover of players. In spite of that, they have been able to bring in experienced talents, which the Mathare United founder, Bob Munro, believes will add to the flavor and performance of the team.
And with some of these veteran players coming back to the team from ISA, I think we have real possibilities that some of these youngsters will thrive under their example and role models, and that we will get back to being the Mathare team that we were before.
With the return of the 2020-2021 Kenya Premier League action, teams are gearing up to bring their best foot forward by attracting different sponsorships, Mathare United being the latest to benefit. Ivy Kavai, Switch TV Sports.
Well, that sports story by Ivy Kavai wraps up our news broadcast tonight. Many thanks for watching. My name is Lincoln Wambugu. Our sign language interpreter is Tracy Dorcas. Good evening.